Hi, here's my live audience. How many of you have come across stories where people have lost the ability to walk and the physicians have had a very difficult time in diagnosing the patient? I will be introducing you and informing you both of a very rare and sometimes deadly condition called Guillain-Barré syndrome, also known as GBS. GBS is a condition that we all must know of for the simple fact that there is no known cause and the symptoms vary for patient. Any chance that I am able to bring this topic up, I do it for the simple fact that my soon to be 7-year-old daughter is 3 years post GBS as of June 2019. I will be discussing the many different causes, symptoms, diagnosing process, and medical treatment affiliated with GBS. Now that you all have listened to some of the points made, imagine yourself at work when you suddenly receive a very frantic and dramatic call from your mom informing you that your soon to be 4-year-old daughter is not able to bear any weight, nor is she able to stand up on her own. Living with an autoimmune deficiency is a constant reminder of how your immune system is attacking itself. What is Guillain-Barré syndrome? Guillain-Barré syndrome is an autoimmune deficiency disorder that attacks the peripheral nervous system. The peripheral nervous system consists of 43 pairs of nerves consisting of the motor and the sensory nerves. These nerves are all connected to the brain and the spinal cord. These nerves control the entire function of the body, specifically in the person's sensations, the movements, and motor coordination. Guillain-Barré syndrome is an extremely rare condition that affects 1 in 100,000 Americans. This condition does not discriminate against age, gender, or race. All the reported cases have had a variety of early onsets. Some of the reported cases have been after a patient has received the flu shot, after the patient has finished the antibiotics prescribed to fight infection, or after a patient has come out of surgery. We are all unique individuals. With this being said, GBS affects every single patient differently. Patients have reported experiencing the following different symptoms: a weakness or tingling sensation in either the leg, the legs, the face, or the arms. Many often, these symptoms lead to paralysis of either the right side of your body, the left side of your body, or your waist down. Or in my daughter's case, she lost any movement in her right leg. How is GBS diagnosed? GBS is diagnosed by many different options, and it all depends on the person's symptoms. It can either be diagnosed by diagnostic imaging such as X-rays or MRIs, specific blood tests, nerve testing, and lumbar spine tap testing. Lumbar spine tap testing is where they take a needle and take liquid from your lumbar spine and send it to the lab. What is the proper medical treatment to fight GBS? Again, the proper medical treatment to fight GBS would depend on each patient and all the symptoms. Patients can either receive one or more IVIG infusion treatments. IVIG stands for intravenous immunoglobulin treatments, which is just a fancy word that means that you are receiving an injection or an infusion of antibodies to help that are necessary for your body to fight off an infection. Other patients have needed a mix of medical treatment, which can range from IVIG treatment, speech therapy, physical therapy, occupational therapy. Meanwhile, others have required constant use of follow-ups by either pediatrician, immunologist, and neurologist. In my daughter's case, she receives physical therapy twice a week, speech therapy once a week, and she's also is receiving constant follow-ups by immunologists, neurologists, and pediatricians. Let's summarize everything that we have learned so far. GBS is a rare and unknown condition that can affect any of our population, male or female, as early as 1 year old. Please remember that if any given time of your life you experience any of the symptoms, that you follow up immediately with your physician. Please always take your health extremely serious. There's only one of you in this world.